Hundreds of workers across Ontario commute to work by car or transit. Others have the option to cycle or even walk. But since the state of emergency declared March 17, 2020, many have been working remotely or on temporary layoff. With the province's plan to reopen workplaces and workers slated to return, there's much anxiety about how to commute safely. Policies established by employers, including compressed work weeks, flexible working in the office, and working from home, can assist. For others who travel by public transit, municipal transit companies across Ontario have implemented other measures to ensure the health of riders. Others still may consider walking or biking part or all of their commute. Suffice to say that getting to work during the pandemic will look very different going forward than in the past. Hello, I'm Lisa Hawkins, a Program Development Officer with the Workers' Health and Safety Centre. As Ontario's designated health and safety training organization, we deliver a wide range of classroom and now virtual training courses to assist in making your workplace healthier and safer. This webinar is one in a series we're developing to help keep you safe throughout the pandemic. Today's topic is on getting to work safely during COVID-19. This webinar focuses on common means of commuting pre-COVID-19, employers' duty to protect worker health and safety, employers' policies to reduce commuting, different means to commute during COVID-19, health risks associated with public transit use, protecting measures by public transit companies to protect commuters, protecting workers upon arrival at the workplace. Prior to the pandemic, commuting to work was the norm for the majority of workers in Ontario. For the foreseeable future, this will continue. Previously, most in the province traveled to work by car. Where the commute was 30 minutes or less, they traveled alone. However, those who spent at least 60 minutes commuting generally carpooled. In large urban centers, a significant percentage of the working population took public transit, whether that be streetcar, bus, or train. Due to the lack of infrastructure and distance between home and work, few had the option to cycle or bike, even part of their commute. That now may change. Employers in Ontario have a duty under the Occupational Health and Safety Act to take every precaution reasonable in the circumstances for the protection of a worker. But what is reasonable in the circumstances? Is it permitting workers to work remotely where they can, allowing certain tasks to be completed at home, reducing commuter pressure for those that cannot work from home? These are conversations your Joint Health and Safety Committee or your health and safety representative can have. Even before the pandemic, many employers had adopted policies to reduce the amount of time workers spent commuting. This included compressed work weeks, flexible work hours, and working from home. As a result of COVID-19, these options were extended to a wider audience of workers, at least temporarily. In some cases, these arrangements may continue for several more months. In Toronto, for example, the mayor has indicated all city employees currently working from home will continue to do so until at least September. A number of large corporations with offices downtown have committed to doing the same. While there are disadvantages, technology makes it viable and certainly safer until cases of COVID-19 decline and a vaccine is developed. As before the pandemic, there are several different means to travel to and from work during COVID-19. As the virus spreads by touching your eyes, ears, or mouth with contaminated hands or inhaling respiratory droplets expelled by someone who's infected, commutes where workers are in close contact with others present the greatest risk. Going forward, many may voluntarily change the ways and means by which they commute in an effort to reduce the spread. For many workers, driving remains the only viable option to get to work. Where this remains the case, workers are advised to drive alone in their own vehicle, one that no one else uses, wash hands, and before. Where the vehicle is owned by the company and shared between crews, the Joint Committee and worker representative can encourage the employer to have the vehicle disinfected thoroughly and regularly. If you need to share a ride with people outside your household, Roll down the windows to increase ventilation, and have the driver and passenger wear a mask. While a number of towns and cities in the province support bike lanes for both leisure and commuting to work, the network of bike lanes in Toronto may be the best known. Toronto's current system of protected bike lanes is small and largely limited to the downtown core. Even so, approximately 20% of those in certain city neighborhoods cycle to work or school. The pandemic has prompted several municipalities in the province to accelerate plans to add both on-street and designated bike lanes. Cycling for pleasure has seen a resurgence in popularity during COVID-19. It's hoped with enhanced infrastructure, those that cycle for pleasure may now soon have the option to bike to work. Cycling can be protective in the time of COVID-19, as physical distancing is easier and you're only contacting your own personal bike. And as the mode of travel is outside, the risk of exposure to the virus is reduced. But there's still some advisable precautions. Ride in single file, stop 6 feet or 2 meters behind the cyclist in front at traffic lights. Physical distancing should also be observed when parking the bike. Again, where there's a possibility physical distancing cannot be consistently maintained, a face mask should also be worn. Few workers have the option to commute to the workplace exclusively on foot, but walking is frequently a component of their commute, whether that be walking from their home to the bus stop or from the subway station to work. Walking, like cycling, has distinct advantages during the pandemic. Walking to work, or even part of the commute to work, can decrease the risk of exposure to the virus, as one has a greater likelihood of physical distancing. Along public paths, those commuting on foot should walk in single file and maintain a distance of 6 feet or 2 meters from one another. Where physical distancing cannot be consistently maintained, a face mask is advised. The emotional and physical benefits of walking make it even more appealing, not to mention the cost, free. A large percentage of the population in cities in the province take public transit to work. For some, public transit is almost all of their commute. Others may drive, walk, or bike to the nearest mass transit system. The risk of contracting infectious disease has always been higher on mass transit due to contact with shared surfaces and the respiratory droplets of others. The same can be said of COVID-19. Previous research suggests the link between commuting on the Underground in London, England, and an increased risk of respiratory disease. Other studies have shown changing systems, for example, from a bus to a train or from one train line to another, also increases the risk as one's opportunities for exposure increases. Further, the amount of time spent on public transit in the close quarters further contributes to the potential for spread. While there's no major international studies completed to date that specifically examine the risk of transmitting or contracting COVID-19 while on public transit, the Chief Medical Officer of Health for Ontario, Dr. David Williams, has indicated it's a definite possibility. With many workers working from home and others temporarily not working since the start of the pandemic, public transit ridership fell substantially across all public municipal systems and by more than 80% in the GTA. So it was a lot easier to distance in the past than it will be in the future. Public transit systems have also implemented measures to protect riders, both routes, stations, and vehicles. Transit systems have made changes to help physical distancing. These include adding buses on busy routes, adding vehicles during the rush hour service, and operating on a holiday or weekend schedule. Some of the more common changes in public transit stations include rerouting foot traffic to reduce crowding, installing signage to remind commuters to physically distance, installing hand sanitizer dispensers at station entrances, and contactless payment for initial ride and transfers. Changes on public transit vehicles include enhanced cleaning and disinfection of buses and trains, installation of plexiglass barriers at the driver's seat, cordoning off seats within 6 feet or 2 meters from the driver, blocking seats to ensure physical distancing between passengers, boarding of passengers at the back rather than the front door, installation of hand sanitizer dispensers at the back door, and either mandatory or recommended use of face masks by drivers and passengers alike. But there are significant differences across municipal and provincial transit systems. For example, the public transit system in Ottawa and Peel are requiring passengers to wear face masks. In Toronto, this remains only a recommendation, despite the Amalgamated Transit Workers, Local 113, the union that represents TTC drivers and operators, advocating for the safety of their members and everyone else using the system. Cleaning and disinfection protocols and schedules also differ. The TTC has a daily cleaning regime that starts with wiping down hard surfaces and ends with an antimicrobial fogging treatment to disinfect the entire vehicle. Other smaller transit authorities are focused on regular disinfection of touch and grab points, such as buttons, railings, handles, and straps. We can learn from other countries whose public transit systems have been fully operational for several weeks. South Korea has deployed a specialized crew at each mass transit station to clean and sanitize vehicles up to 5 times a day. In an effort to limit capacity and ensure physical distancing can be maintained, the Netherlands has recently introduced a mobile application to allow riders to make reservations on local buses and trains. New York City has established and strictly enforces maximum limits on the number of riders on each subway train. Still, other city systems across Europe have instituted passenger temperature checks. Whether workers can or will exercise the option to avoid public transit by driving, biking, or walking is unknown. Public transit is the only viable form of travel for workers. The general guidance from public health is as follows. If, of course, you can, travel at off-peak times, allow extra time for commuting, maybe biking or walking part of the route instead, reducing the number of vehicle changes, physically distancing on vehicles and platforms, stand or sit near a door or window, wear a mask and gloves, and sanitize your hands before and after. Sanitizing gets rid of the germs you may have picked up during your commute, and sanitizing before it gets rid of the germs you might bring into the transit system that could affect others. And until you sanitize at the end, do not touch your face. The journey to the job often continues in the workplace. You still need to get to your workspace, and this may involve taking an elevator. Joint committees and worker representatives can play a part by encouraging employers to ensure property management companies take different steps, like installing hand sanitizer dispensers outside each elevator door, disinfecting elevator keypads regularly, and posting limits for elevator capacity. Many workers must change into workwear or uniforms upon arrival at work and before starting their shift. To decrease the potential for transmission, joint committees and worker representatives can suggest employers post limits on room capacity, stagger work shift to reduce the pressure, disinfect high-touch areas regularly, and block off every other locker if possible to assist with physical distancing. Again, this is a good discussion for the Joint Health and Safety Committee and/or worker representatives to have with the employer in order to find solutions. During the transit to your job and back, of course, always sanitize your hands. In addition to a series of webinars on COVID-19, the Workers' Health and Safety Center is now offering virtual learning experiences. We've modified a number of our most popular programs such that they can be delivered via a virtual classroom. Recently, we added a course on the hazards posed by the virus that causes COVID-19. You can register for any of our programs by visiting the website. This webinar, as well as others we've hosted in the past, are available on our YouTube channel. This presentation will be posted on our website shortly after the webinar finishes today. While all of us at the Workers' Health and Safety Center are now working from home, we can still be reached by phone or email. You can also follow the latest developments via Facebook or Twitter. Let us know how we did today by completing the poll posted on your screen. We'll now be answering a few questions on this topic. Any questions submitted during the webinar will be answered and posted to our website at a later date. Car shares like taxis, Uber, and Lyft aren't mentioned in this seminar. Is it safe to commute to work by rideshare? Policies have been instituted by all companies that govern drivers and passengers. Drivers are to disinfect high-touch areas of the vehicle after each ride, and both the driver and the passenger are required to wear masks. Passengers, of course, should disinfect their hands both before and after the ride. My mates and I work the same shift and live outside the city, so carpool. Can we do the same when we return to work if we all wear a mask? The current public health directive prohibits gatherings of groups of 5 or more outside your household or the people that you regularly live with. If there's less than 5 of you carpooling together, this is not a violation of the rules, but you should all wear masks, ventilate, and disinfect your hands both before and after travel. I plan to wear a mask when I take public transit to work next week. Do I also need to wear gloves? Well, there's no rule that says you need to wear gloves, but gloves and hand hygiene are very important since this virus can survive on hard surfaces for hours, and if you touch an infected surface and then touch your face, you can become infected. Wash or disinfect your hands before and after each trip, and if you're using gloves, which are a good idea, be careful taking them off and on and storing them, and wash and disinfect your hands. Gloves can block the virus, but if they do, they also carry the virus. So using gloves isn't much value if you don't correctly take them off or if you just throw them in your pocket. Another advantage of gloves is that may discourage you from touching your face. Thank you for joining us today. We look forward to seeing you at our next webinar.